It's time to ask an expert, and my friends from OHC have been in many times over the years offering information about cancer, updated developments and treatments and protocols. They've taken great care of me and my dealings and struggles with cancer since I was diagnosed, and so I strongly encourage you, if you get a bad diagnosis, sorry, I know it sucks, but you got some great docs over at OHC to help you out, or get a second opinion. It's 888-649-4800, 888-649-4800. The website is ohcare.com. I'm happy to welcome to the 55 KRC Morning Show advanced practice provider Kim Mullins, who are going to move away from cancer. And this is crazy. She's one of the providers at OHC caring for patients undergoing revolutionary treatment, including what we're talking about today, which is low-dose radiation therapy for patients suffering from osteoarthritis. Kim, good to have you here on the program.
Thank you. I'm glad to be here.
And I was telling you off air, I'm glad. I was looking in amazement. I didn't realize that you could use radiation therapy to treat osteoarthritis.
Right. Most people don't. However, it's been done in Europe for probably over 3 decades. So we have lots and lots of research that shows this is a great alternative treatment.
So what is low-dose radiation vis-a-vis osteoarthritis? How does it work? And let's dive on into what goes on.
Okay, so most people are familiar with high doses of radiation being used to treat cancer. Right? So radiation at high doses can kill cells, which is our aim when we want to kill cancer cells. However, we know that at low doses, the radiation actually biologically does different things, and it decreases inflammation. So that's why we can use it for osteoarthritis. So using low-dose radiation for osteoarthritis helps to decrease the inflammation, which as a result, then we can see decreases in pain and increases in mobility of those joints.
Well, why has it taken so long for us to embrace this therapy here in the United States? Do pharmaceutical companies have something to do with it, he asked?
Yeah, perhaps it does. Perhaps it does. But regardless of why it's taken so long to get here.
I didn't mean to stick it to you like that.
It's no problem. The benefit of us waiting a little bit longer is actually twofold. One is, since it's been done for so many years in Europe and in particular in Germany, we have really good research that we can base guidelines off of. So,
protocols are in place.
Very much so. And we know that this is a safe treatment, and we have years and years of experience with patients who have had it. And so we have long-term information now to know it really is safe and it's an effective treatment. So that's one of the benefits. And the other benefit is that, the technology has evolved during that time. And so our radiation machines that we deliver the radiation from are very, very highly technical and very precise with how we deliver the radiation.
You said effective. What kind of success rate are we talking about here for folks struggling with osteoarthritis?
Yeah, so in general, the consensus is anywhere from 70 to 75% of patients receive some kind of benefit.
Whoa.
Yeah.
That is really impressive.
It is.
And it comes along without the side effects of the pharmaceuticals that a lot of people are taking, which I hear can be really, really problematic when it comes to this.
Sometimes, yeah, situations vary. But the low-dose radiation really has an incredible side effect profile in that it's pretty much zero. So there have been lots of studies. I know. What kind of treatment has zero?
Wow.
But this in particular does, and it has to do with the fact that it's just such a low dose of radiation that has an effect on the body that just decreases inflammation. So there have been some studies that have shown maybe like 1 in 1,000 people might get a little bit of skin redness, but honestly, that's not the norm. So the side effect profile is very low. Skin
redness versus dealing with the pain of osteoarthritis, and you're not even guaranteed the skin redness.
That's
75% success rate.
Yes.
You're going to have phone ringing off the hook today. So I guess who's eligible for this in terms of, patient profile category? Because there's a lot of people out there going, I got to call, I'm going to call.
Right. That's a good question. So there are 1 in 7 people in the United States that have arthritis, that have osteoarthritis, right? This affects a lot of people. Our patient profile looks like patients who are 50 and older who have diagnosed osteoarthritis. The joints that we can treat include the feet and the ankles, the knees, the hips, shoulders, hands and wrists, and spine. So this is a lot of joints that we can treat, right? And a lot of the patients have tried several different means of treatment. They've tried nonsteroidal drugs, they've tried physical therapy, bracing, any number of things. Joint injections with corticosteroids or with the gel that they can inject. None of those preclude the patients from having low-dose radiation therapy, and it won't actually interfere with any of those future treatments. But there are also a number of patients who either want to delay having surgery or they cannot have surgery for one reason or another. And this is a wonderful alternative in those situations.
So what does the treatment entail? Over what period of time? I'm sure one dose of this low-dose radiation is not going to cut it. You're going to have multiple. So what's the story? If someone walks in and they're eligible for the treatment, they fit the right profile, what should they expect?
So we'll meet with you first.
Of course.
Right. So we'll do our consult, and then the next step is to do some mapping. So we want to be very precise with where we deliver the radiation. We do that by CT guided imaging, and so there's a CAT scan that's involved, but there's no dye, so it's very simple. And for those who are concerned about being in the tube, this is not the in the tube test. That's an MRI. So the CT is much easier to tolerate. So we get a CT, and then we do the planning. The patients come back. It involves generally 6 to 8 treatments. The treatments are about 10 to 15 minutes. They are separated by at least a day, so 2 to 3 treatments a week until those 6 or 8 treatments are received. Patients don't feel anything during the treatment. The radiation is like a high-powered X-ray, so you don't feel it or see it. It won't interfere with any medications that they're doing, no activities that they normally do. So they come in, they get the treatment, they get up, and they go on their way.
Well, my executive producer wanted to know if insurance might cover this.
Yes, actually it does.
Oh, good news, Joseph. I think he's calling you guys right now.
Okay. Medicare covers it, and then most insurances tend to follow suit, and that's what's happened in this situation.
Well, that's wonderful news. And how, after the battery of treatments is over, is that when the patients can expect to feel the relief from the pain?
Yes, in some cases. There are actually some situations where about halfway through or towards the latter half of the treatment, the patients will actually start to notice some difference. But yeah, you're right. Generally afterwards is when patients start to notice the bulk of the benefit. And that benefit can last from several months up into a year and sometimes longer.
And you're always there to get another round of treatments down the road.
Yep.
Well, that is absolutely wonderful. Now, how is it that my cancer doctor friends ended up providing this particular therapy? It's not cancer related. It's osteoarthritis.
Right. Well, at OHC, we have the technology to provide these treatments. And obviously the research that's coming out of Europe and Germany is just, it's so incredible, the benefit that this can have. And so, it's our mission to provide the best quality care that we can to our community.
Yeah.
That includes cancer patients, but it also includes being able to use the technology we already have in place to treat other conditions that are benign.
It makes perfect sense. And obviously with 1 in 7 Americans struggling with this, there's a huge demand out there for relief.
Right.
Well, this has been a rosy discussion. With OHC, we're talking about cancer, and then we're talking about clinical trials. We're talking about, survival rates. This is just all across the board positive information. So folks out there, osteoarthritis, turn to my friends at OHC. The number, ready? 888-649-4800. 888-649-4800. Online again, ohcare.com. Kim Mullins, it has been a pleasure meeting you and talking with you about this.
My pleasure.
Keep up the great work.